Well, thank you, Conrad, for that weather report right there.
Got you guys.
Absolutely. And Crohn's disease could be something you have heard about, but just aren't exactly sure what it is. Today, we're going to have Nurse Christina Paris joining us and shedding a little light on what is Crohn's disease. So thanks for joining us. Welcome back.
Hi, glad to be here.
Always happy to have you here, bright and early in the morning, always pleasant. So let's go right into it. So we see a lot of commercials, and we see medications to treat UC and Crohn's disease, but what are those disorders exactly?
Yeah, absolutely. So Crohn's disease is it's a immune-related disorder. Okay. So it's your body, and it can occur anywhere from your mouth all the way, from where we put food in to where food comes out. And the GI tract, I'm just going to review that really quick. So that's
probably good.
It's important in food digestion. It helps us absorb nutrients. It's also kind of the firewall that blocks pathogens from getting into our bodies and causing problems. So with Crohn's, sometimes an immune-related response means things like Pseudomonas or Listeria can get in and cause issues. Now, ulcerative colitis it's an autoimmune disorder. So same kind of thing, your body, except it's your body fighting against itself. So your body thinks that there's a pathogen or something there, so it starts this response. But what happens is it's a really exaggerated response. So think about an ant, on the table here. And if we were just to squish the ant with our finger, that's a normal response. That's how we would kill it. Now, if we really wanted to over-exaggerate or kill it, we could use a lighter, but that's going to do damage to the table. So ulcerative colitis is like that. It will do more damage than just killing it like it's supposed to. Now, if we use a blowtorch, it's going to completely obliterate or get rid of the table. And that's a very over-exaggerated. So that's sort of what Crohn's does. It does that more permanent damage to the lining of the colon.
So what are the most recognizable symptoms of Crohn's?
So a lot of people are going to have pain, especially in the lower right quadrant of their belly. And that's where the ileum is, because the ileum and the, I'm losing it on my part. Anyway, that's one of the major areas where it can occur. I think the colon was the other. And you're gonna feel tired. You might have loose stools because your body isn't absorbing the water like it should. That's also what the colon does, or it brings water in. So it's gonna do this over-exaggerated. You're gonna have weight loss, fatigue, night sweats. You can have mouth or tongue pain too if it's starting there, if you're getting ulcers there. Mouth sore, skin rashes, joint pain, and you can even have eye redness from it too.
It seems like a lot of things.
Yeah. Wow.
I know. And so anytime you have symptoms, it's always, of course, good to go and talk to your provider, because it could be something as easy as acid reflux, peptic ulcer disease, or ulcerative colitis and IBS and all these others. So anytime you have something with GI tract, go talk to your doctor.
Might as well, right?
That's good advice. Good advice there. So can this be treated, or is there a symptom management plan for the disorder?
Yeah, so it is, because it can cause permanent damage. They'll use biologics and or immunosuppressant drugs. So that's what we give often with cancer too, and surgery is a late stage last response, so they can actually go in and surgically remove that area. The problem is with Crohn's is it will be here and here and here and here, where ulcerative colitis just kind of stays right here. So even if you remove this spot, because it's bad, you still have these. So it's not a permanent solution, but if you have an area that's really, really damaged, it can bring some relief. So medications, surgery, late stage.
And how quickly can this develop? Is this a long-term thing, or is it just a quick thing that comes and goes?
So they say genetics is a huge factor, and then, like I said, exposure to different pathogens. But it can come on, I think, any time in a in your lifespan. But it's more genetically, you're more predisposed that way.
Wow.
Yeah.
No, that's good advice there. You know, always good to keep the eye open for things like this, and then talk to your doctor, of course, if you see any symptoms.
Absolutely, and you know, and the appendix is also in the lower right quadrant.
Oh boy!
So sometimes
so you got a lot of things for me to worry about.
So you're like, what could it be if it's in that area?
Just get it checked out, right?
Right, exactly. Always go and talk to your doctor. That's what they're there for.
Absolutely. Well, thanks for coming on in this morning.
Thank you so much.